I offer this substitute to add to and enhance this important and compassionate legislation that is before us today. There have been many voices calling for private insurance coverage for the diagnosis and treatment of autism spectrum disorders. This is a worthy goal, and I am fully committed to supporting it and will be proud to stand here with you today and vote in support of it. But there have been other voices with remarkably similar stories. Children with other brain disorders whose families also thought they had good insurance until a child receives a diagnosis and they find that the treatment they needed will not be covered. These families face the same choices: pay out of pocket if they have the means, or forego treatment and watch their child fail. Colleagues, I assure you, we are able to craft legislation to cover all brain disorders, including those on the autism spectrum, as they should be covered, on par with general medical disorders, and in so doing, put an end to insurance discrimination in much the same way that 43 other states have already done. The premium cost impact of parity has been actuarially established, projected by the Congressional Budget Office, and confirmed by decades-long experience of states and the Federal Employee Health Benefits Program to be less than 0.5%. I stand here today so certain of the minimal impact on premiums that to address the concerns raised about the potential cost of providing full mental health parity, I've included in the substitute 2 off-ramps. The first, using a model that has worked well in states like Arkansas, if any healthcare purchaser sees an increase attributable to providing mental health coverage of more than 1% in any given year, they can be exempted from this requirement. Second, if come January 2014, this Michigan requirement exceeds what the Federal Affordable Care Act requires qualified health plans to provide, the state law will be set aside. We can afford to provide equal coverage for all of our children. We can't afford to turn our backs, sending a message that some children are less worthy. Some have said that considering mental health parity with autism spectrum disorder coverage will cause both issues to be derailed. But I assure you, I do not rise here before you today to kill the autism bills. If this chamber wants to vote down this amendment and move forward solely with the autism bills, that's our choice as a body. No harm done to the autism issue. My fellow senators, we have the opportunity today to see that our children with autism spectrum disorders get the coverage they need and they deserve, and also to add equally important fair and non-discriminatory protection for our children with other brain disorders. I urge your support of this substitute. Thank you for your consideration.